Hello, folks. Good afternoon. Thanks for joining us. We appreciate your time. We'll give it just a couple minutes before we get started. Folks are being admitted from the waiting room. You can see our agenda for the calls on screen. Thank you for being here. Gustavo Inaugural with the Health Improvement Partnership of Santa Cruz County. We'll be getting started in just a couple minutes. Welcome, folks. Thank you for joining us. Gustavo Inaugural with the Health Improvement Partnership of Santa Cruz County. We'll be getting started in just a minute. HIP team, are we ready to get started? Thumbs up. Excellent, folks are still joining us. Well, good afternoon, everyone. Thank you for joining. My name is Gustavo Inaugural. I'm a program coordinator with the Health Improvement Partnership of Santa Cruz County. Thank you for joining us for our inaugural convening of the Community of Practice. This is a partner meeting between HIP and CBOs and clinics who are involved in the ACEs Practice Grant. And this will be our first convening of the Community of Practice. And we look forward to sharing discussion with you all and talking about how this group can best work together and convene to keep driving this work forward. You can see our agenda on the screen. We'll go through a brief welcome and introductions. We'll have it in a round robin style. I can help call on folks and we'll share our name, our affiliation, and we have a question on screen about what is your experience working on ACEs, prevention and response. After that, we'll talk a little bit about why we're going to convene this group, the genesis behind the Santa Cruz County ACEs Community Practice. Then we have Nicole Young and Susan Paradise are joining us to talk a little bit more and give an overview about the Santa Cruz County Network of Care. And Laura will lead us through a draft of the Santa Cruz County ACEs charter that's been designed, and we're going to be looking for feedback on that. And then we'll wrap up. We'll see where we are by that time. So thank you all for joining us. Again, my name is Gustavo Inaugural. I work with the Health Improvement Partnership of Santa Cruz County, and I'm going to introduce my team member, Laura.
Hi, everyone. I'm Laura Bashart, Program Manager with HIP. So great to see so many of you. My experience working on ACEs prevention and response is really through the work that we're doing at HIP in collaboration with our providers in the safety net, Doctors on Duty, Salud, Santa Cruz Community Health, and our county clinic partners, as well as our community-based organizations. And through our current work, we're really trying to strengthen the relationships between clinics and community-based organizations and our managed care plan. So this group is kind of an extension of that, intended to be inclusive of everyone in the network of care. So really pleased to see some new faces and looking forward to getting to know all of you. And I'm going to pass it to Trudy to introduce herself.
Hello, everyone. A lot of familiar faces here. I am Laura's co-lead, her right-hand person, so to speak. I helped write the grant for our practice funds, and I'm really excited that we're kicking off the Community of Practice much sooner than we had thought we would, but we recognize that the work of the practice grant should be a little more inclusive and include other people that are not funded by the practice grant. So I'm really looking forward to seeing how this grows over the next few months. And I will hand things over to Priscilla.
Thank you, Trudy. My name is Priscilla Vasio. I am a program assistant here at HIP. And my work that I've done with ACEs has been also through the collaboration that we have with our practice grant partners. And I'm excited to learn from you all. And it's really exciting to see all of you here. I'll pass it on to Thomas.
Hello, I'm Thomas Hicken. I'm an intern at HIP. My experience with ACEs has been the last year and a half that I've been at HIP, trying to help in anything I can with this and learning everything I can. I will pass it over to Dennis Haynes.
Thank you. And thank you for inviting me to your first meeting. It's an honor. My name is Dennis Haynes. I'm with the Merced County Office of Education's Family Resource Center, and also kind of take the lead with our trauma informed network of care here. We call it ACEs Inc., Adverse Childhood Experiences of Informed Network of Care of Merced County. And my experience with ACEs is, first of all, I'm an individual who has probably had a high ACE score since I can remember as a child and then growing up. And then the work that we're doing with the ACEs Aware grant, we got the first grant, the second grant, the practice grant, and now hopefully we'll go after the fourth grant. So thank you very much for inviting me. And I'll pass this on to Nicole Young.
Hi, Nicole Young. I'm a local consultant in Santa Cruz County and have been involved in the ACEs work in a number of different roles as a consultant to First Five, working with public health. This is part of the Thrive by Five initiative that I help manage. And so I have my fingers in lots of different threads of this. And how about Susan? You want to go next?
Sure. Thanks, Nicole. My name is Susan Paradise. I work for Santa Cruz County Public Health, and a rich history in the ACEs work. Definitely high number story, and then 20 years as a clinician in community mental health, working with youth exiting the foster care system, and now the past 4 years at public health, and along with Nicole and a few others of you here, we got the first two ACEs Aware grants through public health, and we'll tell you a little bit more about that later. And I will pass it to Allison.
Hey, thanks, Susan. I'm Allison Guevara. I'm a social impact consultant and co-director for Cradle to Career Santa Cruz County, which has been part of the previous ACEs Learning Series and the current practice grant. And I will pass it to Julio.
Thank you, Allison. Hello, everyone. My name is Julio Andrade, and I am honored to share co-director with Allison Guevara, and I'm here supporting Allison and the ACEs in the last 2 years that I've been part of C2C. So thanks for having us here. And I'll pass it over to Keisha.
Good afternoon, everyone. Keisha Browder, CEO of United Way of Santa Cruz County. Been a part of this work through our 211 database in collecting and understanding a community asset mapping of where we are today in terms of local organizations, programs, and services here. So to tell you a little bit more about that, I turn it to Cassandra Flores.
Hello, everyone. My name is Cassandra Flores. I work with United Way of Santa Cruz County 211. And our work is, how Keisha was saying, to collect data from other nonprofits, CBOs, to see the work that they're doing with ACEs awareness, as well as ACEs services, and collecting that information and providing a website where they clinicians then can provide those services to their patients.
And to round us up, we'll turn it over to Audrey Jones, who's also with us.
Thank you, Keisha.
Audrey may be having some microphone issues, but Audrey is a part of our work with United Way. She is our intern with CSUMB, and her senior thesis, her capstone project, is to follow our ACEs community in practice and to be able to report back on what we've accomplished here as a county to consider as a best practice for other communities to use. So we're happy to have Audrey on board today. And with that, we'll pass it to Leanne.
Hey, Keisha. Oh, I didn't mean to turn that off. I'm Leanne Luna. I'm with Monarch Services. And I am here because we've been familiar with ACEs for a long time, but we are now beginning to implement within our client intake. So we are excited to be among other folks who we can hopefully learn from and network. I see a few folks that we've already been working with, so that's been great, who've been supporting us. So happy to be here, and I'll pass it over to my coworker, Maria Barranco.
Hi, everyone. I'm excited to be here. Thank you for having us. My name is Maria Barranco. I'm one of the program directors here at Monarch Services, and similar to Leanne, we're just starting to implement ACEs within our organization. So we're just here to work together and then, of course, learn more from you as well. And I'll pass it on to, I am not sure who hasn't gone yet.
I can help you out. How about Cameo? Do you mind introducing yourself?
I think you said, was it me you were talking about, Cameo? Okay.
Excuse me, Cameo. Thank you.
No worries. I just want to make sure I heard right. My name's Cameo Cole-Casey. I am a nurse practitioner and behavioral health director at Doctors on Duty. And we are familiar with ACEs, and we utilize them in our clinics, and we screen individuals on an ongoing basis for about last year and a half. And we're just working on with this initiative to expand on that and expand our resources. I see Katie, so I'll pass it on to Katie, who's also with Doctors on Duty.
Hi, my name is Katie Vandervoort. I'm the COO of Doctors on Duty, and you kind of just got an overview of our initiatives for ACEs. I'll pass it on to Dr. Pricey.
Hi, and I'm Dr. Scott Pricey. I'm the medical director for Doctors on Duty, and we've been doing ACE screenings now for about 2 years in our medical patient population. And I'm not sure who goes next.
Thank you, Dr. Pricey. Suzette, do you mind introducing yourself?
Sure. My name is Suzette Rochelle DiVigilio. I am a programs director over at Health Improvement Partnership. And I also helped Trudy and Laura and our amazing team work on this grant. So super excited to get this going. My introduction to ACEs was when I was working at the Alliance many moons ago. And on a personal note, trauma-informed care and post-traumatic growth is a passion of mine. So this is near and dear to my heart. I also work closely with SafeRx, Santa Cruz County, which is our substance use safety coalition. So this is something that we work with intimately in many different ways. So look forward to working with you all, and I will pass it to Dan.
Good afternoon, all. Dan Chavez here, Executive Director of SCIO, your local public health information exchange. Have been involved with ACEs since the inception of this grant, really learning a lot and looking to expand the impact of our work through a shared information systems platform. Becky Shoemaker, you are up.
Becky Shoemaker, I'm the Director of Operations with SCIO, and we are just here as a technology partner and hoping to streamline the process and move information and share what's needed to be shared. I will pass it to Ferris.
Thanks, Becky. Hi, everybody. Ferris Sabah. I work as a county superintendent of schools. And one of the challenges we've had is how to integrate ACEs and ACEs data into the school system. I also work at the chair of the board for Salud para la Gente, and so recognize the importance of ACEs as a fundamental part of wanting to have a better understanding and better resources when it comes to social determinants of health. And I will pass it over to, did Dr. Powell already go?
Not yet, Ferris. Thank you. My name is Carmen Powell. I'm the medical director for our pediatrics department at Watsonville Community Hospital, now the Pajaro Valley Healthcare District. And I also wear the hat of doing a lot of health equity work with Stanford Children, so very familiar with ACEs and trauma-informed care and how we can bring that to our healthcare district and also the hospital wide. So very happy to be here. Thank you. And also work with the pediatric health work group.
Thanks, Dr. Pell. I'll help you out. The next person, Luann, do you mind introducing yourself?
I'm Luann. I'm the behavioral health manager at Janus of Santa Cruz. I have some history working with ACEs. I wrote a master's thesis that involved it, and I worked with Resilience up north after the campfire, and we used it. But currently, we're trying to incorporate it into our curriculum in our perinatal unit. So that's kind of trying to gain a deeper understanding and get to know you all since I'm new to the area. So I'm happy to be here.
Thank you, Luann. Danielle Solik.
Hi, I'm Danielle. I'm the health services manager for Santa Cruz Community Health. I was previously with Santa Cruz County Public Health for a couple of years. And right now, I'm not sure who else from my agency is on here, but right now our behavioral health team implements ACEs, and they have for quite some time. And I know that we're talking about a broader implementation across the agency. So I'm mostly just here to listen, I think, and take some mental notes for operational planning going forward. And I did see also from Cradle to Career that Rosia Sanchez was on here before. If she has not introduced herself already, I'm not sure if she's still on. I'll pass it to her. Thank you.
Rosia, are you on with us? Not see your name. How about we hear from Dan Sanders?
Hello. Hi, can you hear me? Yeah. My name's Dan Sanders. I'm a pediatric nurse practitioner at Watsonville Health Center, the county community clinic in Watsonville. And I'm just here to learn more about implementation of ACEs. Yeah, that's pretty much it. I'm happy to be here. Thanks.
Thank you for taking time to join us. Dr. Sakurati, do you mind introducing yourself?
Hi there. Yes, my name is Minu. I also work with Dan Sanders at Watsonville Health Center, as well as at Emmeline and HPHP. I'm an internal medicine and pediatric physician, and we're just getting started on our ACEs rollout. We're fortunate to be working with HIP and our community partners on getting started with ACEs. So we're really excited about that, and we'll be starting our rollout with the Emmeline, the Santa Cruz Health Center, also known as Emmeline. Thank you.
Thank you so much. Next, Dr. Caroline Kennedy.
Can you hear me now?
Yes.
Yes.
Oh, sorry about that. It's like double muted. So I'm Dr. Caroline Kennedy. I work at Monterey County Health Department F2HC clinics. We have 20,000 pediatric patients. We do not receive any grant funding, and we do not have any partners. And we implemented ACEs starting January 1st, and we plan to do them at all of our clinics for all children.
Thank you. Is there anyone that I've missed who has not introduced themselves yet? We want to hear from everybody if possible. Okay. Thomas, do you mind sharing the slides?
I'm sorry, having technical difficulties.
Appears like it. 1 minute.
Yeah, I'm trying to find the screen.
Okay,
Know how it is.
let us know if you want one of us to do that
Yeah.
for you.
I'll jump in.
Okay, all right.
Can everyone see my
Nice. Yes.
Thank you. Great. Thanks for the introduction. I'm very humbled and excited and grateful that everyone took the time to join us today. I think it was good for us to share what our connection to this work is so that we understand who the players in the room are and we can think about those things moving forward. Next, we're going to talk about why we're gathered here today. My team member Trudy and I will share some information about that. So just briefly, in connection to some work that HIP has done around ACEs in Merced, the goal of that work was through research and stakeholder interviews to understand the current state and needs in Merced County to implement and sustain screening, treating, and healing of ACEs. So there's some connection to the work that we're all doing now. And we're really fortunate to have Dennis Haynes on the line, who works at the Merced County Office of Education and their Family Resource Council Operations Supervisor. I'm going to pass it over to Trudy, who's going to speak a little more about this before we introduce Dennis.
Yeah, so the ACEs in Merced project was a huge eye-opener. And through that work, we interviewed so many practices, so many people, including ACEs Inc., ACE Overcomers, just a ton of interviews. And through meeting Dennis, we got connected with ACEs Inc. in Merced County, and he invited us to what is the equivalent of their community of practice. And I noticed when he would send out the invitations, like 67 people are invited to this meeting. And I was working on the project with someone named Mason, who's no longer with HIP. He's moved on to his educational journey. But there is nobody that I know who has more passion around ACEs than Dennis Haynes. I mean, he just gets so excited. His face lights up. He's so passionate about it. And during those meetings, it was a community of practice. They took on some work like how to sort out referrals from primary care offices. And we were so impressed by their work that when it came time to apply for the practice grant, we built that idea in. Dennis Haynes' name is literally in our application for the $1 million practice grant. And we just thought it would be so fitting to have him here today. And our goal was to have some sort of kind of membership model to sustain the work of the practice grant when it ends in November, at the end of November in 2023, and also to include people who are not, like I said earlier, included in the practice grant. So, we have Janice here, we have Ferris here from the County Office of Education, and I'm hoping that Dennis and Ferris have maybe talked in the past about what's going on, and there's so much going on in the county. So we have primary care practices that are doing ACE screenings. We have First Five doing ACE screenings. We have other community-based organizations or CBOs doing ACE screenings. We have, for those who screen positive and need referrals because they are experiencing toxic stress, we have a limited amount of resources here in Santa Cruz County. So we have, referrals to mental health. Many of our clinics have behavioral health integrated. For other practices, maybe for the pediatric practices in Santa Cruz County, they don't have integrated behavioral health. And so if you want to refer someone, we've heard that sometimes it's a 3-month waiting list to get kids and families in. And then the other buffering resources like quality sleep, outside spaces, supportive connections, you know, how do we make those connections as a county, as a team, as Allison often says, don't forget, it's the pair of ACEs, so adverse childhood experiences, but adverse community environments as well. And so by forming the community of practice, it's premature for us, but we saw this opportunity to launch it. And I think maybe at our next meeting, we should talk a little bit more about our work around ACEs in Santa Cruz County. So we had in spring of 2021, we had a cohort where we launched an implementation project with 3 clinics. And it would be great to share with the folks that haven't been along the practice journey, share all the work that we have done so far, making connections. It's just, I'm just floored by how much we've done in so little time. And I don't mean HIP, I mean all of our partners, really. And I want to do a shout out to Caroline Kennedy, because Caroline is single-handedly kind of driving ACE screenings at her organization. They have no funding. Like she said, she had wanted to apply for practice funding, and others put the kibosh on her applying for that funding. And so when we met with her and talked to her about the work that she's doing implementing ACEs, I asked about, well, you know, are you submitting for reimbursement? She's like, no. I'm like, so you can't get any reimbursement for doing ACEs? And she's like, no. And I said, well, why are you doing it then? I mean, because we know that it's a hard sell and you have to get buy-in in the implementation. And she said, without a second's hesitation, because it's the right thing to do. So Caroline, I don't know if you're still listening, but you know, your words and your passion still linger in my head. So Dennis, I'd like to just formally thank you. And we have a couple questions for you if you care to kind of field those, or if anyone else has questions. So I wondered, you know, have you and Ferris ever connected to talk about ACEs in your respective communities?
No, this is the first time I've met Mr. Sabbath. I don't know. So it's interesting that, you know, depending on the area of where your expertise is, I'm really low on the totem pole when it comes to the Merced County Office of Education. You know, I oversee a family resource center. We changed from a council to a center about 6 years ago because of the work that centers do. So I have not had the opportunity to meet with Ferris. So this is the first time. So nice to meet you.
Great to meet you, Dennis.
And I loved your blog, Dennis, that you wrote. It was great.
Well, we launched that this week. Thank you very much. Our newsletter for our ACEs Inc. work. And, you know, we're a little bit slow, I think, in some things that get done. And I'm very proud of after that work. And they asked me, can you do a blog? It's like, okay, what do I do? Because I think what I do is, and I call it the backyard, because it's a lot of stuff that when I see your names, I'm like, oh my gosh, you know, Santa Cruz is so, I mean, you're 30 people of representation here of just incredible individuals here. And I look at the backyard stuff and I laugh at that, because my wife will say, well, what tools are you using? Well, it ain't power tools. It's you know, ratchet wrenches, and sometimes those break. And so I got to use just wrenches. And so a lot of the work that we do, I think here is neighborhood stuff and knocking on door stuff, and the stuff that sometimes we've gotten away from over the last, you know, 5, 10, 15, 20 years that I've been doing this work, is going back and connecting with people and talking to people and taking our time doing that. And so that's why I call it backyard stuff, because it takes time to do that. And we're here for the long haul. I take it, and like you said, Judy, I do get excited about it, because, and I love that you said, this Dr. Kennedy said, it's the right thing to do. This made sense to me. You know, I didn't know what ACEs was, you know, 8, 10 years ago. And once I heard it, it's like, gosh, this makes sense. I come from a background of facilitating parenting curriculums for families that have their children removed. And there was always something missing in that curriculum. They're all great curriculums, evidence-based, they're all great, but one piece was missing. It was this. So it made sense to me. And when the ACEs Aware initiative came out, it made sense. And I thank God for Dave Lockridge, who's the executive director of ACE Overcomers. And he's kind of the father of ACEs because he was doing it 18 years ago here. So, I mean, he gets this stuff. And it made sense to work with him, to partner with him here in Merced County. And I think the biggest thing, and I think you're doing this too in your counties and your communities, is let's have one message. We don't need, 2 and 3 and 4 different messages out there. And I think that was what I impressed on you, Judy, with is that, hey, you guys are coming in, let's have one message here so it doesn't confuse our healthcare providers. It doesn't confuse our community-based organizations or faith-based or law enforcement, our educators. So I think that was one of the things that we picked up on. And we got the planning grant, which made sense to us to do a plan. And I don't like just doing plans to sit them on the shelf and then do nothing with them. That to me is a waste of my time and energy. I think we would all agree with that. And so once the plan was done, I was very fortunate that we have First Five here that put it in their funding to do ACEs work. So Dave and I got funding for that. We're very fortunate to have Dignity Health here who gave us funding for the ACEs work. So as we're piecing this together, that's what, you needed that, I guess, individuals. That was the driving force. Yeah, we had 67, I think it's 89. Not all of them come to our meetings. However, we keep growing it every month because what I found, and maybe you'll find this too, is not everybody knows about ACEs. Here at Merced County of Education, I can go next door and say, hey, you guys know about ACEs? They don't know. So my work's never going to be done because we need to continue to educate and communicate this education to our community members. I think that's where we're at is I keep pushing. I'm grateful. And we had our meeting last week. We still meet 3 times a month. The committees meet twice a month and the community meets once a month to continue to educate and to drive that plan that we said we were going to do to cut ACEs in half in 1 generation. I take that seriously. And I think I'm not a system change type of person, but this makes sense for systems change. So so I'm just very grateful that I have these opportunities. We got the attention of a Bay Area funder who's funding part of my position to do this because you need that front runner. I see Gustavo here. It's good to see him. You need that front person that's going to do this work because all of us are all busy doing the other stuff. So and then we got the practice grant, which we're very fortunate. And I have to shout out to Dr. Sosa from Valley Children's Hospital in Madera County. I mean, she is just an incredible doctor and just works. We funded their pediatric office here in Merced County, and she's just incredible. So it's great to have those individuals that believe in this and want to continue to grow in it. Like I said, we're slow in some of the things that we're doing, but we're continuing to add pieces to it. And I think that's the biggest piece for us.
So I just want to call out Keisha's chat. I don't know about you, but Dennis's energy is making me more proud of this incredible team on this Zoom. This is the right thing to do. So thank you. Laura, you had a hand raised?
Yeah, thank you. I know we only have 1 more minute on this agenda item, but Dennis, since we have you here, I'm just wondering if you have any words of wisdom for us as we start out this collaborative, and specifically around growing your network in Merced County. How did you find that new people became aware of ACEs Inc? Was it through word of mouth from members telling others in their network?
Yes. Because that's one of the challenges, and everybody knows me now when I come on, and that is how many people you talk to, how many, and if you take a look at our newsletter, you see at the bottom it says membership. Yeah, we want them to get into our membership too. Did you get online? Do you need the information? We have the toolkit that we put together after we finished our plan, and we always hand that out to people. We send it to them via emails. We got the newsletter now, so now I'm sending out the newsletter to everybody. I sent it to my superintendent at Merced County Health Education and our stakeholders. So we're starting to, as I just keep hitting it, and all of our members and stakeholders hit it too. And if they don't, I have my philosophy is if you're, and I've been working in nonprofits for over 35 years, and as a board member, I'll say, if you're not giving money yourself, then how can you ask others to give? So if you're not on our ACEs and you're not, applying the membership, then how can you go out there and ask everybody else to do the ACEs if you haven't done the training, if you haven't done training in your own organization, then how can you ask others to do that? So we're always pushing. I take the plan very seriously. We have the 4 committees. We still meet with all those 4 committees. So, I keep, I had, like I said, we had our meeting last week, and one of our schools district superintendents who was on said to me, Dennis, thanks for keeping the charge. You got to have someone that's going to keep the charge and keep them accountable. And I have no problem doing that.
Thank you, Dennis.
Thank you, Dennis.
Thank you guys for inviting me. Appreciate it.
We appreciate you taking time to join us. Thomas, do you mind sharing screen? Right on. Next slide, please. So another part of why we're convening is that it's part of our grant activities. We committed to establishing to formalize an ACEs in Santa Cruz membership model, to form a collaborative of community stakeholders and ACEs champions, as well as our Medi-Cal managed care plan, convening monthly with a shared and aligned purpose to collaborate to increase screening for ACEs and identify and support those who screen positive and are experiencing toxic stress. Next slide, please. Some of our grant deliverables: to create a distribution list with contact info and organization, a group charter, which we will cover later, monthly meeting agendas and meeting minutes, action steps towards defining a sustainability plan or a model for grant activities and outcomes. Next slide. Our next speakers, who are also very fortunate to have with us, is Nicole Young and Susan Paradise, who are going to give us a brief overview about the Santa Cruz County ACEs network of care, in particular, some learning sessions that they convened. Nicole, Susan, are you all ready?
We are, and I think Susan's going to start us off. Do you need us to show our own slides, or do you have
Just
those?
let us know when you want us to change slide.
Okay.
Okay.
Thank you.
Okay, well, I'll start and you can go ahead and change slides. Yeah, David Brody was supposed to be here with us too, and also Najib Camille, but you get me and Nicole today, and I'm sure the others will join us at some point throughout the collaborative. Next slide, please. Okay, so again, I'm Susan Paradise from Santa Cruz County Public Health, and this is just a brief overview of the ACEs Aware work that began in Santa Cruz a few years ago. And today we're going to focus on the network of care, particularly the learning sessions that we convened. So first off, who was on our team and what did we do? So public health was the lead applicant and did grant management and the initial convening of our partners. We then subcontracted with First Five to create and facilitate our ACEs Aware Network of Care Learning series. We subcontracted with Health Improvement Partnership to convene peer-to-peer learning sessions with our FQHCs, and also to work with our entire network of care to improve communication and share referrals through the Unitas platform. Also, the Santa Cruz County Human Services Department was a key planning partner from the beginning as conveners of our child abuse prevention work group, and also experts in the building community resilience model. Next slide, please. So the approach that we took to engage and connect with our community was one of cultural humility. And this approach is based on three key components. One, lifelong learning and critical self-reflection. So we met as a steering committee quite frequently for planning and then debriefing. And then we would reflect and we would course correct. We were really committed to the building community resilience model, and we continually gently reminded each other of our equity focus. We listened to feedback from a place of courage and curiosity. Second concept is to recognize and challenge the power imbalances that are present. We were mindful of who has a voice, when and where. We really opened up and modeled conversations about race and racism in partnership with each other and our parent leaders. and made space for smaller breakout groups to give participants a safer space to share with each other in their preferred language. We tried to mitigate the power imbalances by using simultaneous translation, a graphic note taker, and bringing parent voices and non-clinical staff voices forward in our sessions. Third concept, institutional accountability. We got explicit about practices and systems that perpetuate inequities. The question we always ask, what's in our soil? Clinicians and parents came together and explored why is there such a short time for visits at the safety net clinics, and shared the felt experience of not having a specialist that speaks your own language or is your own gender. Now I'm going to pass it to Nicole to give you a few more details about the actual series.
Thanks, Susan. Go ahead and go to the next slide. And so as Susan was describing, we were really committed to equity, both in the content of what was being shared and presented in the sessions, as well as the process, how we went about doing it. So we adopted an ecological ecosystems framework, an approach, and really, as Susan was saying, did our best to really listen to and center community voice, and not just look at what the needs are kind of at a surface level, but really push ourselves to dig deeper and think about root causes and the role of structural racism in ACEs. And then in terms of process, making it accessible, as Susan was mentioning, making translation and interpretation available at every session. And you'll see some of our slides actually have bilingual content, and really structured and designed our sessions to be interactive for participants of all languages. And so took a lot of work and forethought and advanced planning, but was definitely worth it. Next slide. So our first 3 sessions featured the Center for Community Resilience, or CCR, and that's an organization or a program out of George Washington University, and they really are the ones who coined this phrase, the pair of ACEs. And it's a way to, and they use this tree, if you want to go ahead and press enter to show the next piece of information on the slide. They use this image of a tree to describe adverse childhood experiences as the branches and the leaves of a tree that will show visible signs of vulnerability and illness, or those concerning outcomes or symptoms that we often notice and name. If you click again, we'll see the roots. If they're growing in toxic soil or adverse community environments that lack equity, in terms of policies, norms, and systems that are actually designed to produce poverty and discrimination and violence and so on. If trees are growing in that toxic soil, characterized by these systemic drivers of inequity, the question is really, how could we ever hope or expect to see a healthy tree, healthy leaves, healthy branches? And so this graphic and this concept of the pair of ACEs, and particularly if you click again, the recognition that structural racism really is, if we keep digging deeper, the root cause of this pair of ACEs. We kept this model, this concept at the forefront of our minds as we were thinking about what does it mean to implement ACEs screenings in our community? What does it mean to address and prevent the pair of ACEs? Next slide. And really that led us to acknowledge and remember that screening for ACEs and then referring to services is one way to care for the branches and the leaves of the tree, to support healthy individuals and families, but that really as a network of care, it was our responsibility, it's the right thing to do, to tend to the roots and the soil, to create those connected, equitable, and accountable systems and supports. Next slide. And then, so our first 3 sessions were with the Center for Community Resilience, who introduced us to this model. In our last 3 sessions, we wanted to build on our own local strengths and examine what's in our soil. And so we started by featuring a panel of 4 parent leaders who you see in this screenshot. And Erendira Guerrero and Allison Guevara facilitated that panel discussion for us. And asked the parents to share what their hopes and their dreams and their family strengths and challenges were. 2 of the parents were Spanish speakers and the other 2 were bilingual, as well as the panel facilitators. And so it just really, again, gave us the opportunity to be part of a rich and meaningful discussion, not just among service providers who often have these kinds of conversations together, but also with our community, our parent leaders. Next slide. And then in the next session, we facilitated a bilingual panel discussion with 2 of the returning parent leaders and 2 service providers. And the panelists talked about the importance of screening for ACEs and the impacts that can have on families. And it was a powerful moment when one of the panelists expressed a common worry that I'm sure is relatable to many of you, a common worry about ACEs screenings, when she said, "I don't want to imagine ACEs screenings opening 1,000 wounds." And so the panelists also talked about the importance of connections and trust, so that ACEs screenings aren't just a thing to do, but they're part of the healing process instead of being re-traumatizing. So as you can see, and as Susan mentioned, we had a graphic recorder who captured key concepts in real time in English during the live sessions, and then we had them translated afterwards. Next slide. And we also asked the panelists what a network of care meant to them. And so these are some of the things that stood out for them that they shared. Things like a whole village that is equitable and includes and encircles the family. And it starts with providers recognizing that families are the ones driving the car, that families are driving the car while providers are there to offer the GPS or the guidance. So we thought that was another really insightful, powerful phrase that we kept coming back to. Next slide. And then by the final session, the parent leaders facilitated the bilingual panel discussion themselves, with support, but they were the ones asking service providers the questions in either Spanish or English. And that really flipped the power dynamics and created what felt like a really rare level of honesty and vulnerability. And some service providers even acknowledged during that session that they hadn't been able to finish the ACEs screening on themselves because of what it brought up for them. So it really, again, begged the question for us, how can we as the network expect families to open up about their experiences without taking the steps and care to build that safety and trust? Next slide. And so those bilingual learning sessions left everyone feeling the fire, and we convened a community advisory group led by Allison Guevara with the parent leaders and service providers who had been part of those panels, and asked them to help develop recommendations for centering equity and community voice in authentic, sustained ways, both in our ongoing ACEs work and other initiatives as well. Next slide. And the community advisory group's recommendations really came down to trust. That authentic, equity-driven community engagement has to be intentionally designed to be thoughtful, responsive, understanding, safe and strength-based, and transparent and transformative. And so each of the original ACEs Aware planning team members, meaning First Five, Public Health, HIP, Allison through her consulting work, me through other projects I work on, we've all continued to work on embedding these recommendations into other programs and initiatives that we're involved in, like Thrive by Five, like Cradle to Career, like the new child abuse prevention planning efforts that are going on. It's because really we want to make sure that the ACEs Aware work and the community engagement work lives on. Next slide. And then in one of the ACEs Aware learning sessions, Dr. Lisa Gutierrez-Wang from Children's Behavioral Health provided an overview of California's ACEs Aware roadmap, which is essentially a guide to creating a network of care. And in that roadmap, it emphasized the importance of providing access to services and resources that buffer the toxic stress effects. And these 7 stress busters you may be familiar with are backed by scientific research and basically proven to be approaches to prevent and reduce the harmful effects of toxic stress. And so First Five had some grant funds remaining and worked with United Way to basically take this concept of the stress busters and do basically an inventory of our locally available buffering services and integrate that into our local 211 system that United Way manages. And so If you scan that QR code, I believe it takes you to the 211 website, and you would be able to find resources related to those stress busters. Next slide. And then finally, we've taken all of those foundational frameworks, the pair of ACEs, the resilience tree, stress busters, all of that, and layered them together and integrated them into Thrive by Five's theory of change. Thrive by Five is a countywide initiative. And this is basically our description of how we address the pair of ACEs and achieve the vision of thriving children and families in a resilient, just community. So acknowledging the importance of tending to the soil and the roots in terms of our systems and our norms, and taking a look at our own programs and practices and policies as a way to grow and nurture resilient, strong trees. And so that, I think, is where I will end, and just want to appreciate and say thank you for giving us the time today to share this.
Thank you, Nicole. Thank you, Susan. Folks were loving the slides, and there are several requests to have them shared. I imagine that'd be fine if we get those out to people. Thank you. Next, I'm going to welcome my teammate, Laura, who's going to go over a review of the draft of the charter for this group. So Laura, if you're ready, I will mute myself and pass the mic to you.
Sure, thank you, Gustavo. And I wish we could take a moment to really let Nicole and Susan's presentation sit in and sink in, and appreciate all of the work that's been done up to this point. But in the interest of time, I'll just say thank you, Nicole and Susan, for being here and for that great presentation. And I am putting in the chat a link to the draft charter document that we've put together for this group to help us kind of ground in what our purpose is. When planning for this community of practice, the HIP team decided really early on that it would be led by those who show up and participate. So in the spirit of co-creation, I want to walk us through this draft together, and I will overview each section and then open it up for some comments or suggestions. So let me share screen. And please do feel free to comment on the document as we go through. You all should have access to do that. But the mission of the ACEs community of practice is to strengthen the trauma-informed network of care in our county, to increase screening for adverse childhood experiences and support for those who screen positive and are experiencing toxic stress. Our genesis touches a bit on the bold goal set by the first Surgeon General, Dr. Nadine Burke-Harris, to cut ACEs in half in one generation, and also acknowledges the diverse group of stakeholders in Santa Cruz County that are involved in this work, and that we were inspired by the ongoing work of ACEs Inc. in Merced County. So our purpose is to convene monthly with this group of stakeholders engaged in the work of screening and responding to ACEs and toxic stress, to share lessons learned, best practices, successes, and barriers. And as I mentioned, we really want member engagement to drive the direction and value of this collaborative. And I zoomed in a little bit, so hopefully that's easier to see. Our vision. So what we think that this group can help facilitate is the sharing of resources to increase partnerships, services, and workforce needed to expand and sustain screening, prevention, and treatment of ACEs and toxic stress. Maintaining connections in our local network of care to better understand who's doing what to support screening, prevention, and treatment, especially given our changing Medi-Cal reform landscape. And to deepen our understanding of the role of community drivers of health and well-being, as demonstrated through the pair of ACEs model, adverse childhood experiences and adverse community environments. And of course, we want to identify a sustainability plan to model to ensure our continued collaboration. Just our timeline, kind of what we've already touched on. This group is being convened by HIP beginning in February, with funding through the ACEs Aware Initiative Practice Grant through November 2023. And by that time, we will have taken action steps towards defining a sustainability plan. So if there are any comments that group members want to unmute and share now, we're running really close to the top of the hour. So of course, it's totally fine if you want to spend some more time looking through this. We'll send it out in the follow-up materials. But you're welcome to share via chat or by making a comment on the documents. Let me zoom out to see if there are any comments here. Okay. Well, not seeing any raised hands or comments, so I think maybe we'll leave it here for now. Please do feel free to spend some more time reading through this. Just one page, outlining our purpose, and if there are any suggestions that you have of how we can improve this and make it better and really reflective of what the group wants, please do feel free to reach out or leave a comment. I will stop sharing for now. Okay, so just before we wrap up, comments, I think if you want to back out of presenter mode and we can take some live notes on this slide. Our next steps, we'll be sending out a meeting series for a recurring meeting last Wednesday of the month, same time, 12 to 1. So keep your eyes open for that. We'll also send a follow-up meeting email with the slides, the recording, and some notes, and we'll link that on HIP's webpage as well. So between now and our next meeting, please feel free to spread the word if there's other partners that you think should be here that you haven't seen attend yet. Feel free to forward them the meeting invitation or let us know. And I think in our last 3 minutes, we did want to hear if folks have any meeting topics that they want to be sure to address at our next meeting on March 29th. Feel free to put those in the chat or unmute. There's also going to be a question about that on our meeting evaluation, which I'll put in the chat right now. So if you want to spend 1 minute filling that out, letting us know how you found this session and what you would like to focus on at our next meeting on March 29th, would be much appreciated. But I think I'll close us out and give you back 2 minutes. Thank you again, everyone, for joining. It was such a great way to kick off this work. Really appreciate you all.
Thank you, Laura. Thank you, folks, everyone who's able to attend, our speakers, Dennis, Susan, and Nicole. And thank you, everyone, also for taking a moment to fill out that evaluation. It really helps us learn how we can best work together. Again, our next call will be on March 29th. You should be receiving a recurring invite so that those get on your calendar and you can keep working together. There's no other questions. You can return 1 minute of everyone's day. Thank you. Thanks, everybody.